Man has unlocked the secrets of nearly every frontier, except the brain. This amazing organ remains one of the most intriguing mysteries of life. How does it work? Why is it so fragile? One South Florida man has discovered just how fragile as he battles for his life. Just 2 weeks ago, this Air Force veteran was diagnosed with the most deadly brain tumor, a glioblastoma. Now, in a breakthrough procedure, we'll watch as surgeons try to remove the tumor while he is still awake and actually talking to them.
What that means is that the patient will be interactive during surgery. They will be able to move, speak, and they will be being examined by the neurologist as we operate on them.
The scariest thing is the thought that you're going to be awake. I love you.
Love you.
How can you imagine having somebody that they're working in your head and you're awake talking to them about what's going on?
Even more amazing, doctors will make history by using his own tumor to create a vaccine that could keep the cancer from recurring. It's science fiction in action.
What this vaccine represents, it really represents cutting-edge technology using their own body to fight their tumor, and it really gives patients hope and the best chance for long-term survival.
One of the things that I said to the doctor was, I want to live. I want to live. And I'm going to live through this. I have no doubt in my mind.
Could these two medical breakthroughs give Mark new hope?
1 year. If I could only live 1 year, that would be my greatest fear.
Hello and welcome to a very special episode of Breakthrough Medicine. I'm Jay Adams. You're about to watch a team of doctors use everything in their power, including 2 medical breakthroughs in an attempt to save one man. He's just been diagnosed with a deadly brain tumor, and his hope lies with a team from UHealth, University of Miami Health System. His name is Mark Murray, and the experts at UHealth's Sylvester Comprehensive Cancer Center are about to give him another chance at life, while changing the face of medicine right here in South Florida. Just 2 weeks ago, Mark's entire life changed in an instant on a long drive home with a small pain in his head.
I was driving home on the highway and I felt like I had either spider bite or a bee sting behind my ear. And it felt like someone was pouring scalding hot water just down my arm. The next day, I kept on having the burning in my arm. It felt like my hand was on fire, and I couldn't find the right word to put into the sentence. And that's what started to really worry me. I went into the emergency room, and they went ahead and did a CT scan, and the doctor came in and he said, I have good news and I have bad news. And the doctor said, you didn't have a stroke. I said, so what did I have? He said, you have a tumor. And that worried me.
Mark has been diagnosed with a primary brain tumor, a type of cancer that starts and stays in the brain. Although it doesn't spread, it's very aggressive and very deadly. Dr. Roberto Hiros is co-chairman of the Department of Neurosurgery at the University of Miami Miller School of Medicine.
So it requires a specialized team dedicated to these, and not just somebody who does a little bit of everything. You have to have somebody who's really dedicated to this. And that's why we recruited Dr. Komotar, because he's specifically interested in operating in tumors of the brain, what we call intrinsic brain tumors.
Mark is facing what is commonly a lethal, fatal condition. When you're talking about a malignant brain tumor, most people consider it only a matter of time. This is a tumor that if you don't treat it with surgery and then followed by radiation and chemotherapy, it's lethal within months.
I went to one of the other hospitals up there, and the doctor that I saw gave me a very bleak prognosis, and that there wasn't anything much he could do with me. And I mean, it ripped my heart out of my chest. But the bad thing is that it took Rhonda's soul out of her. I mean, it tore her up really bad. So as soon as I got out, I got a hold of some friends, and I said, you know, what should I do? And she said, Mark, go to Miami.
I met Mark about a week ago. He's dealing with obviously a very difficult condition, something which scares a lot of people. He's taken the news very, very well. When you're talking about such a scary condition, staying positive is really the first and really the most important step in having a good prognosis.
There's doctors that you listen to, and there's doctors that you can feel the love come from them. And when he talked to me from his heart, I was like, this is the man that I want working on me. And he sat down and told me everything, answered all my questions, was just, I mean, fantastic. And I just got that connection. I mean, just total confidence.
Mark's best chance is for surgeons to remove as much of the tumor as possible, followed by radiation and chemotherapy. But the location of the tumor presents an incredible medical challenge.
Mark has a space-occupying lesion, a tumor, in an area of the brain that's surrounded by eloquent cortex. So that part of his brain that is responsible for processing language is involved in the area where this tumor exists. Your brain's a lot like a city with different neighborhoods and different areas that run real estate. And some areas are really high-value properties, and other areas not so much. In Mark's case, it's that language area that's involved in the tumor.
If doctors damage the healthy tissues surrounding the tumor, Mark could lose his ability to speak. Surgeons have only one option: operate on Mark while he's still awake. University of Miami Hospital is one of the few hospitals in the region qualified to perform this delicate procedure.
The patient will be interactive during surgery. They will be able to move, speak, and they will be being examined by the neurologist as we operate on them. The patient is pain-free, they are comfortable, they are sedated, they will not remember the procedure afterwards.
In the operating room, I'm going to be interacting with Mark continuously throughout the surgical procedure. I'll be talking with him. I'm going to be using my iPad and showing him images and asking him to identify objects.
A lot of the things I'm going to be showing you in the OR are things like this, so I just want you to repeat some things.
Okay.
So say it.
Pen,
Okay.
tree.
What I'm looking for is to make sure that Mark can identify the objects that I show him and that he can continually interact with me so that I can gauge the area remains intact and that the fibers between the areas of interpretation and expression remain uninjured.
The moment Dr. Gallo notices any language deficit, I know to stop and to move to another area. And so Mark himself will be putting boundaries on us as to where we can work and where we cannot. You would only do this procedure if the tumor is located in an area of the brain which controls function, so motor, language. Only under those circumstances would you consider doing the surgery awake.
When I first met Dr. Komatar, he told me I can do this. I needed to hear someone that in their heart they felt that they could make me better. And that's what I heard from him. And that's who I wanted working on me.
The brain has no nerve endings, so Mark will not experience pain when surgeons remove the tumor. Local anesthesia will ensure he doesn't feel the incision. Because of Mark's relatively good health, UHealth doctors have made another decision. They will enroll Mark in a clinical trial available at Sylvester to actually create a vaccine out of Mark's tumor.
The way that we're going to make Mark's vaccine is we will harvest his tumor during the surgery on Monday. That tumor will then be shipped up to Boston, where certain proteins get purified from Mark's tumor itself. These proteins are then concentrated and given back to Mark as a simple injection in his arm. The purpose of this brain tumor vaccine is to spark the patient's immune system to fight the brain tumor and attack it and hopefully keep it from coming back. We're one of only a few medical centers in the state of Florida offering awake craniotomies, and one of only 10 medical centers in the country offering this particular vaccine clinical trial.
The scariest thing for me right now is the thought of being awake. When you're thinking about the fact that somebody is you're gonna be awake, you're gonna be able to speak, and they're gonna be inside your head, it messes with your mind a little bit.
When we come back, we'll watch this groundbreaking surgery and learn how doctors hope to prevent the cancer from returning by creating a vaccine from the tumor itself.
I love you.
Love you.
Take care.
You're in good hands.
I am.
We'll take excellent care.
I know you will. Thank you so much.
Just 2 weeks ago, Mark Murray discovered he had a deadly tumor the size of a golf ball in his head. Now, a surgical team at University of Miami Hospital is about to try to remove the tumor while he's still awake and talking.
So we're about to do an awake craniotomy on Mark Murray. He has what looks like a high-grade glioma. It's in his language area. We have really 3 goals. The first is to be safe and not hurt Mr. Murray. The second is to get as much of the tumor out as we safely can. And the third is to hopefully get enough tumor to create the vaccine. How's everything?
Good.
How was your night?
Good.
All right.
They took great care of me up there. You got good people here.
No, definitely. So we're just looking over the films preoperatively, just confirming that the area we're most concerned with is just in front of the tumor.
Yes, correct, Mark.
Just in front and just below the tumor. That's the area of the brain which controls language. So here we have the tumor, and here we have the area of the brain which we're most concerned about. So what's most concerning is whether or not Mark is going to be able to speak with us during the case. His wake-up test was a little bit concerning. He was speaking, but he wasn't really conversant. He wasn't compliant.
Hey, Mark, it's Dr. Gallo. Open your eyes. There you go. Okay, listen, you're in the operating room, remember? Do you remember? Okay, all right. He's still a little groggy.
If he's that way in the middle of the case, we're not able to test his language, then we're going to have to be a lot less aggressive with how much tumor we take out because we won't have that kind of interactive feedback during the case.
We're going to be making incision.
Skin.
Mark is under anesthesia as surgeons make the first incision. Once they are ready to remove the tumor, he will be brought out of anesthesia enough to talk with the neurosurgeon. This is a critical point in the surgery. Dr. Komatar has located the tumor inside Mark's brain and is ready to awaken Mark from the anesthesia. If Mark is able to speak with the surgeons, the team will have a better chance of safely removing the tumor. It's a remarkable but tense moment.
Mark, open your eyes. Look at me. Look at me. Look at me. Good. Open your eyes. Open your eyes. Good. Good. Excellent.
So this is a portable stimulator. It releases a small amount of current between the tips, so I can discretely stimulate different parts of the brain. If there's a change in the exam while the patient's talking to Dr. Gallo and I'm stimulating, then I know that that's an important part of the brain, and we can't violate it. If I stimulate and there's no change, then that's a part of the brain which we can use in our approach. So right now, Mark is awake. He's talking with Dr. Gallo, and we have real-time feedback as we're taking the tumor out. More so than just the MRI or the neuronavigation. You have a feedback from the patient. As long as his language is intact, you know that you're in a safe area.
Dr. Gallo detects difficulties in Mark's speech and quickly directs Dr. Komatar to move to another part of the tumor.
Christopher Robbins lived at the other,
Okay, so that's bad. Wherever you were, you arrested him at the stimulation.
Mark's speech immediately returns to normal. This real-time feedback from Mark helps the surgeon set safe boundaries for removing the tumor. This is the reason for the awake craniotomy.
You get this and you get extra points. A squeeze box or an accordion. Very nice. Very, very nice.
So we're almost done with our resection. This is where the tumor was. This is the part of the brain which controls language. It's called Wernicke's area. And his facial motor area is right here in front. So this is the region of the brain which controls his face movement. This is the region of the brain which controls language. And this is where the tumor was. We're almost done taking it out. So. All right. No, we're done. We're
Okay without it?
It looks like we've got all the tumor out, which we can see. He's had no change in his language function. So, and we certainly got enough tumor for the vaccine trial. So, in all respects, I think it was a very successful surgery. Okay. All right, we're going to start closing up.
I think it was a very successful surgery. All three of our goals we accomplished. The first thing was to not hurt Mark, and he had no language deficits during the case. The second goal that we wanted to accomplish was to remove as much of the tumor as we could see, and it looked like we were able to get out all of the tumor which we could see. And then the third part was to be able to get enough tumor to create the vaccine, and you have to be able to remove 7 grams of viable tumor, and we were certainly able to do that.
The initial surgery was successful, and Mark has started his recovery. But he is also about to make history in South Florida. When we return, doctors administer the vaccine made from his own tumor. To learn more about cancer breakthroughs in South Florida, log on to uhealthsystem.com. We'll be right back.
Mark is doing great. It's been less than 2 weeks. It's about 10 days. And he's back to normal activity. He is exercising. He's eating normally. His pain's under control. His language is close to normal. He's having some slight difficulties every now and then in terms of his word-finding ability, but nothing that is unexpected. Mark's postoperative care is going to consist of a combination that includes chemotherapy and radiation. The radiation is going to be anywhere from 4 to 6 weeks.
Though Mark does face some difficulty in speaking because of normal swelling after the procedure, he's making great progress. This can be credited to 2 things: a quick diagnosis and fast action by UHealth's Sylvester team, according to Cheryl Shetsky, who survived a brain tumor herself more than 20 years ago.
You must stay proactive. You must be with a physician that's in your corner, that is fighting for you. It's so important that you have the right attitude and that you feel like, and you believe in your heart that you can beat this thing, and you're going to do everything that you can to do that, and not just for you, but for the people around you.
It's been only 3 months since doctors first discovered the cancer, and Mark Murray is about to blaze a new trail in medicine. UHealth surgeons removed enough of the tumor to make a vaccine, and today, Mark will become one of the first in Florida to receive a vaccine made from his own cancerous brain tumor. Just after noon, Mark arrives with his wife, Rhonda, and his sister and brother-in-law.
This vaccine represents the future of cancer therapy. The fact that we can have someone's own immune system combat their tumor is an extremely promising step in the right direction. There still remains a lot of work to be done. However, you could envision that down the road, people can receive these vaccines, and not only would it keep the tumor from coming back, but ultimately it would be a cure.
For me, I'm thinking, you know, what a great thing this is going to happen to so many other people. This is going to be the thing that's going to make my life better. The hope that we're getting from this vaccine is making the difference.
You ready?
I'm ready.
All right. No, right here.
All right, okay.
You can just relax. Yeah. Okay, it's gonna be a pinch, okay? 1, 2, 3, pinch. We're all done.
All right. Not bad at all.
All right, good.
All right, good job.
So,
We did good.
There you go.
Thank you.
Here, here.
We're gonna make it all happen.
Amen.
Being able to directly impact the life of someone like Mark and really give him hope for long-term prognosis when you're dealing with such a grave disease really is one of the most satisfying parts of my job. I'm very proud of Mark, obviously. He's gone through a lot. He's had a tough surgery, he had radiation, he's still on chemotherapy, he's now gotten the vaccine, and I think he's doing great, and I certainly am very proud and very hopeful for him.
I think so, I agree too. Everything is, everything coming together, everything is where it should be, and, without it all happening, it wouldn't have been you.
It's important to realize that this vaccine is a clinical trial, and although it's unproven at this point in time, it certainly offers patients a promising therapy for them when they'd otherwise have no hope. And we're fortunate enough to have it down here in South Florida as one of the only programs in the country here at UHealth.
Mark has a brighter outlook because of advances available here in South Florida. To learn more about cancer breakthroughs, log on to uhealthsystem.com. Thanks for watching. I'm Jay Adams. Join us next time for Breakthrough Medicine.